All right, so pharmacist interventions part 23. These were from yesterday and today. I had a patient yesterday, or a caregiver, picking up Abilify Maintena, 300 milligrams, which is an injectable Abilify. It's an antipsychotic. It was flagging against Zyprexa and oral Abilify. So it had on the file the patient was on 2 other antipsychotics, oral formulations. So I asked the caregiver, patient was not on oral Zyprexa, but they had previously been on oral Abilify to assess tolerability. That's normal. It's recommended to be on the oral version before you do the injectable to make sure the patient's tolerating it. So I noticed the dose is kind of low. It was 1/2 of the 5 milligram tablet. So the patient was actually on 2.5 milligrams. So I just mentioned it to the caregiver to say, hey, this is kind of low. We're treating a patient with bipolar who was having psychosis, and it's recommended to pretty much be on the dose that you're gonna have therapeutic levels with if you're doing an injection. So a more appropriate dosage would have been like the 10 to 15 milligrams if we're at accurately wanting to assess tolerability. But that's just something I mentioned. It also requires an overlap too. Caregiver was not aware that it required an oral overlap, is what we call it. So the lead-in is when you take something up to the injection, you inject it. Some antipsychotic injectables, you don't have to continue the oral one on top of the injection. So you take the injection and you stop taking the oral, but with the Abilify Maintena, you keep the injection. And then you keep the oral Abilify for 14 days, along with it to obtain therapeutic concentrations. This is different than the Aristata, the Abilify Aristata. There's a couple recommendations with that, but sometimes you keep the overlap longer. Another intervention I had was yesterday. I had a patient picking up or dropping off a prescription for Eliquis. It was the 5 milligram. It was 2 tablets twice a day for 30 days. It was from an ER physician that doses incorrect. He already did the load. The load is kind of a misnomer. It's not really a loading dose by definition, but we do have a higher Eliquis or Xarelto dose at the beginning. After someone has a clot, he had a DVT in his calf. So you do 2 tablets twice a day for a week, and then you change him to 1 tablet twice a day. So he was given the incorrect dose. 2 tablets twice a day just continually when it's supposed to be 1 tablet twice a day. For a DVT, if it's provoked, meaning we have a reason for it, treat 3 to 6 months. If not provoked, we usually do indefinitely for patients, or sometimes stop if the bleeding risks don't outweigh the benefits.